The transition roadmap will therefore be a very careful balance between lives and livelihoods. Ours will be a step-by-step approach, feeling our way forward, making judgment calls along the way, instead of one big bang where all restrictions are lifted all at once. And in this process, we will continue to push for vaccinations, implement differentiated rules on social activities to protect the unvaccinated, deploy testing as part of the solution. And we will also continue to put in place safe management measures to protect the general population. Mask wearing in particular is something very effective and simple, which every one of us can do. And so it will likely remain, especially indoors, for quite some time. So what are the changes for preparatory stage from next week, 10 August 2021? The first are social activities. Minister Lawrence Wong will talk about the changes as well as measures to further increase our vaccination coverage. Second, schools. It is an immense achievement that we kept schools open throughout the last 20 months of the pandemic. And this is very important to the holistic development, emotional and mental well-being of our young. But given that children below 12 cannot yet be vaccinated, our primary schools need to take the necessary precautions and put in place the surveillance systems so that we can continue to keep schools open and learning uninterrupted. And this is an important topic, and MOE will make a separate presentation next week. Third area is travel. With most travelers having to serve 14 days in a hotel upon arrival, most people will choose not to travel to Singapore. As a small and open economy, such prolonged border restrictions will hurt our economy badly. Our companies cannot grow if businessmen and managers cannot travel overseas to meet clients and partners. MNCs will find it hard to invest here if their people are not able to travel in and out of Singapore. And if this continues, our ability to create jobs, earn a living, will be seriously affected. And so we have to find ways to start opening our borders. So Singapore has allowed SHN-free travel for selected safe places like China, Brunei, New Zealand. And we hope not too long from now, they will reciprocate the opening, and then we will have travel corridors open. But the reverse is also true, because on the other hand, some countries, such as the United States, many countries in the EU, they allow Singapore-based travelers to go into their countries without quarantine or SHN. So if we reciprocate the arrangement, we will also open up travel corridors. So the good news is that some of these countries have now achieved a high level of vaccination and have reduced their infection rates very significantly. And we will therefore plan to open up vaccinated travel lanes with selected countries, where fully vaccinated individuals can travel to and fro Singapore and a selected partner country without SHN and replace the SHN with frequent testing. MOT is working out the details and will announce when ready. Fourth, healthcare protocols. And there are a few changes here. One, we are expanding our community care facilities, or CCFs. I previously explained that as far as possible, we'll admit COVID-19 patients into CCFs instead of hospitals. After all, 97.5% of infected individuals have no symptoms or mild symptoms. So CCF will be a good site for them to recover. So currently, about 40% of infected individuals are admitted to CCFs. And with more people vaccinated, fully vaccinated, this proportion will increase. MOH is therefore working on expanding the CCF further. We are in discussion with a few facilities, including Connect at Changi, which has 1,300 rooms and may convert part of them to CCFs. Two is discharge protocols. MOH previously announced that fully vaccinated persons could be discharged from isolation 14 days from the onset of illness instead of 21 days previously, as long as their tests show that they are COVID negative or have very low viral loads. We will now make a further adjustments. This is because of strong evidence showing that individuals vaccinated with the mRNA vaccines present low viral loads even within 10 days from the onset of illness. Hence, we will allow persons fully vaccinated with mRNA vaccines to be discharged after 10 days from isolation if their test shows that they are COVID-19 negative or have very low viral loads. 3 is home SHN. Despite the plan for vaccinated travel lanes, which will be quite selective, the great majority of travelers will still need to serve their SHN. We have been allowing travelers from lower risk countries to serve their SHN at home instead of a hotel. We have also been allowing individuals who have close contacts with an infected person to serve their quarantine at home. And these arrangements are on condition that their home environments are suitable for isolation. Both schemes have been working well, with the situation in many countries improving and their people highly vaccinated. We will expand the home SHN scheme to more countries. So travelers from lower risk countries such as Germany, Switzerland, Italy, South Korea, Australia, there are a couple more, can apply to serve their SHN at home and then conduct daily self-tests. As more countries get themselves highly vaccinated, the home SHN scheme can possibly expand further.